Good afternoon, everyone. Thank you for joining us this afternoon. I'm a little thrown off. Usually we are meeting at 11 o'clock on Friday, so 2 o'clock on a Wednesday is new for us. For those of you that I have not met, I'm Marla Gordon. I'm the Director of Clinical Services here at Kendal at Home. And we are very happy to have with us today Keith Friedman and Laura Bliss from DispatchHealth. And I think Laura's going to be kind of listening in, but Keith's going to be giving us a presentation about DispatchHealth. And Kendal at Home is very excited to partner with DispatchHealth in order to prevent hospital emergency room visits and be able to treat individuals in the comfort of their own home. So thank you both for joining us today. And Keith, I will turn it over to you and let you take it away from here.
Great. Thanks, Marla. Thanks for having us on today to introduce DispatchHealth and how we can help your residents to stay out of the hospital for those non-life or limb threatening medical situations. And so that's what DispatchHealth is here for. We literally do bring the power of the hospital to the comfort of the home to help you avoid those unnecessary visits to the emergency room. And we have a medical team that can arrive into your home within just 2 hours of requesting care. And so today I just wanted to start off with a short little video from one of our senior living partners that already works with DispatchHealth, just to kind of give you their perspective on what it's like working with Dispatch and how it helps them as a community as well. So give me just a moment. I'm going to try to blow this back up again to make it big for everybody.
If you click from beginning on the left, that should work.
Oh, there it is.
There you go.
Here at Holly Creek, it's mostly what we call residential living. And then we also have assisted living, and in that memory care, and we have skilled nursing for those who have those needs as well.
Our mission and our vision are both very, very important to us, and that is creating communities where aging is honored and celebrated.
So anytime we can bring care into someone's home and keep them aging in place is always a great opportunity for us.
You know, one of the things that can be really hard and disruptive for the lives of older people and their families is trips to the emergency room when you don't really need to be there.
The ambulance pulls up, the lights are on, everybody's looking out of their windows, wondering what's going on. It creates an anxiety. So if we can avoid that in any way, we try to. And so DispatchHealth allows us to do all of that at the bedside or in the resident's home.
Instead of the resident automatically having to go to the emergency room or an urgent care, they can remain in their apartment and wait for that important care to come to them and provide the treatment that is needed.
And so it's much more dignified and discreet, and we're able to maintain residents' privacy better.
For DispatchHealth, when they come, we call, we escort them quietly down the hallway. There's no bells and whistles. It's very calm. It's like a visit from a friend.
They come in so quietly and the whole place doesn't know somebody's coming in. And they show up immediately and they know what's wrong and they fix it. It's like magic.
Before she discovered Dispatch, I always had the feeling that I was on call. And with Dispatch, that job duty has disappeared. We're able to have just a mother-son relationship and probably even better than it was before.
The quality of life is very much improved here at Holly Creek. because of Dispatch Health and what they offer. You know, I think a lot of folks think, well, they'll show up and do some blood pressure and check your vitals and that kind of thing. No, Dispatch Health does almost everything.
They can start an IV, they can do labs, and the resident gets to remain in their apartment. They treat dehydration. They can do a urinalysis right on site. They can start an antibiotic.
Really impressed me when all of a sudden they could bring out x-rays and bring that right into someone's apartment.
I just feel comfortable calling them, and they come anytime you want. And the nice people they are too. They're just nice to have around, and call you afterwards to see how you're doing.
Dispatch Health is actually helping me and my staff, especially my clinical staff, be more efficient, because when someone had to go to the hospital and then come back, we had to do a whole evaluation process of what happened there, how do we help you from here. With Dispatch Health, it's very seamless.
Dispatch does a great job in communicating with us what was done, what needed to be done, what needs to be done to continue to support the resident. So the attrition of residents drastically reduced. We were running around 15% turnover in our residents in independent living. And when we introduced Dispatch Health, that was reduced to 11 or 12%. It's very, very significant. We're not in crisis, and the residents are empowered to make their decisions themselves about their health. They proactively contact dispatch if something doesn't feel right, not waiting for it to be a complete emergency.
It's important to us that we support older adults no matter where they live, because we know that when we're surrounded by people we know and are part of a community, our health is better as a result of that. So keeping people in their homes is absolutely critical, and Dispatch Health is a big part of that.
So thanks for letting us play that short video. That was one of our partners, a senior living community who currently utilizes Dispatch, and wanted to give their perspective on what it's like to partner with us, not only from the clinical side and also from the side of a resident. So just want to give you a little view of what that's like as well. And again, with Dispatch Health, we are here to give you compassionate care, affordable care, and convenience right in the comfort of your own home for those non-life or limb threatening medical situations. So who comes to my home and what can they treat? Well, we always have a physician assistant or a nurse practitioner. It's going to be one of the two. They're always paired up with a medical technician. So every time we come into the home, we're going to have two Dispatch Health folks arrive on scene. They're going to arrive in fully marked scrubs. They're going to come in a wrapped vehicle, and they're going to come fully equipped with whatever medical equipment they may need for that particular call. And I'll just skip to the next slide here to show you a little bit more about that. And again, we've got a physician assistant or a nurse practitioner and a medical technician. We also have a ER physician that is virtually attending. They're on call at all times. So there are certain scenarios in which our nurse practitioner or physician assistant may have to bring on our ER doc during the visit to get more information as well. So they're always on call and virtually attending. So more about common conditions we treat. We can treat anything from dehydration, skin tears, falls, pneumonia, COVID, diarrhea, cellulitis. Those are some common clinical conditions that we see every single day, but we can treat a whole host of conditions right here in the home. As far as things we can perform anything from a 12-point EKG We can do IV fluids. We can do Lasix. We can do antibiotics. We can do stitches. We can suture and glue and stitch lacerations and skin tears. We can set minor bone breaks and fractures. We can do a lot of advanced blood tests right there in the home. It's point of care blood testing, and you get results right there within minutes. We can do urinary catheter placements. We can do imaging. We can do x-rays, ultrasound. So again, there's a lot of things we can do in the home. You know, roughly 75% of what an emergency room can do, DispatchHealth can do right there in the home. So about DispatchHealth and, you know, how does a visit work and how much does it cost? Well, it's a real easy thing to do to contact DispatchHealth. There's actually 3 ways to contact us. The most common way is to call us on the phone, and there is a dedicated phone number, which I'll share with you at the end. But calling us is probably the easiest. You can also request us to come out via our website at dispatchhealth.com and request care that way as well. But either way, when you do contact us, all you have to do is just give your information. That'd be like your name, your date of birth, address, where you're located. And that's just to make sure that we're even in your service area to begin with. So we're going to ask those demographic information questions. And then we're going to ask the risk stratification questions just to make sure it's deemed safe and appropriate for our team to come out to see you. If we feel like this really is a true emergency, then we would refer you to the emergency room or tell you to call 911 or for you to contact your primary care physician. But if we don't feel like it's that type of medical situation that is a true emergency, then certainly we can come out and treat you. And we arrive within just a couple hours. So more about dispatch. After our visit, we can do a lot of things for you just to make things more convenient and easy. Our practitioners, they can prescribe first dose medications. They can administer first dose medications. In the event that they do need to prescribe any kind of medications, we will call that into your pharmacy for you. We will also send clinical notes to your family doctor, and we also do the insurance and billing piece on our end as well. So there's no need for you to handle any of that billing piece outside of what Dispatch is already doing. So does DispatchHealth replace my doctor? And the answer is no. DispatchHealth is not here to act as a primary care physician or to manage your health. We are here to help treat those acute needs that come on and to really just help fill the gap for your doctor, you know, to really help avoid those unnecessary visits to the emergency room. So again, we're here to really integrate that care for you wherever you're at, whether that's at your home or somewhere else. You could even be on vacation somewhere or even outside of the home. We can still come to you since we are mobile. So more about DispatchHealth and how it's paid for and what's the cost. Well, DispatchHealth, we always bill at the urgent care benefit level. So we bill just like you would if you went to a bricks and mortar urgent care down the street. We're going to bill the same way. So we bill Medicare, we can bill Medicaid, we can bill commercial insurance. In this case, it'd probably be more of our Medicare population. And there's a very affordable service when billed through Medicare. So anytime that we bill Medicare, average out-of-pocket cost is going to be about $27 and change. If you have Medicare Advantage, our data shows the last 5 years, it's going to be about $17 and change for Medicare Advantage. If you have a Medicare plan and secondary insurance, average out-of-pocket cost is $5 and change. So we feel like this is a very affordable option as opposed to going to an emergency room for something that you really don't have to go there for to begin with. You know, when you go to the ER, you're going to see those facility charges, possibly your ER copay, which might be really expensive on some insurance plans. There could be ancillary charges and even an ambulance charge in many cases is very expensive. So we are here to help avoid the ambulance charge, the ambulance ride, and those high costs associated with going to the emergency room. So Dispatch Health truly is an affordable, convenient, and safe option for you in the event that you have an urgent care need. So I'm sure all of us have had that situation where we've gone to the emergency room, and you know that there's a lot of hassle that goes into that. Sometimes you've got to worry about how you're going to get there, whether that's the ambulance or maybe a family member taking you, and just coordinating someone to help you leave the home if you can't drive yourself. And then just even being in a waiting room, alone is not something people want to do. And being exposed to other people around you. Well, the other alternative, and a good alternative now, is with Dispatch Health. We have no waiting rooms. You wait comfortably in your own home. You're in a safe environment, which is your own home. We're giving you more personalized care, and we can see you within 2 hours of calling us. So really, if you're going to even wait to begin with, you might as well just wait in your own home, where it's a lot more comfortable and a lot safer. And of course, back to the cost, when you compare the two between the ER and using Dispatch Health, Dispatch is vastly more affordable than going out to the ER. So just wanted to kind of give you a little side-by-side comparison here, what that might look like. I also wanted to just play a quick little video from one of our own patients and just her perspective and experience using Dispatch Health. So I'll go ahead and play this video. Should be just a couple minutes.
Well, I'm a senior, of course. I've had a lot of chronic problems. I have rheumatoid arthritis and osteoarthritis and fibromyalgia, and so I struggle a lot with my health. I see a lot of doctors, and COVID-19 has made this very, very difficult because I don't want to leave the building. I really don't want to go out in public. So it limits my health care in a lot of ways. I was very concerned when I started having this upper respiratory issue, but because of Dispatch Health, I was able to avoid going to a busy emergency room or going to my doctor. They were right here, and they were able to give me IV fluids, and I think that's helped me feel a little bit better. So I'm extremely impressed with the care. I think one of the most surprising things to me was that the copay after insurance is only $17. I thought it would cost a lot to have somebody actually come to me, but this was wonderful. So it's affordable, it's convenient, it's just a great service. I'm just so happy that this is the way that healthcare is starting to turn. Much more personal experience, much more personal.
So that was a nice short video of just a patient testimonial, patient perspective of just her experience using Dispatch Health. And actually that patient's in quite a bit of our collateral. So if you ever see some flyers that we have, that particular patient is actually in a few of our photos as well. So she's been great to work with. So here's one final page before I'm done. This is a page showing our contact information. If you ever want to contact Dispatch Health, I'm going to actually get magnets to Marla and to whoever else might need it to get it dispersed out to you guys. But for right now, if you do want to jot this number down and keep it handy, you can certainly do that. Calling us at this phone number is the best way to request care. If you're more tech savvy and more technically inclined to use the internet to do it, you can certainly contact us at DispatchHealth.com, or it's actually request.DispatchHealth.com is really even our more direct page. And all you have to do is just type in your name, your location, and your chief complaint or symptoms, and we can call you back within just a couple minutes. So that is another good option as well. Dispatch Health, we are open 7 days a week. That's all holidays, all weekends, 8 a.m. to 10 p.m., 365 days a year. So we're available for many hours during the week. We're not 24 hours, but we're open a good chunk of the day. So 8 a.m. to 10 p.m., 7 days a week. And so I'll see that we can get some magnets out to you as well, which is just a handy little thing to have in case you ever need to utilize dispatch. If I can figure this out, I'm going to try to throw up some maps to show you our coverage area. Let's see if I can do this without really messing things up.
What you might want to do is stop share and then put the map up and then start share again.
Okay.
Just a tip.
Let's see here. Technology, sometimes it's not my strong suit. Let's see. Should I start with Northern Ohio, like Cleveland?
Sure.
Let's see.
While Keith is pulling up the maps, if you have any questions for Keith, you can click on chat at the bottom of the screen and type those in, and we will get to those as soon as we take a look at the maps.
Sorry for the delay. Okay, can you see my screen, hopefully?
Not a map though. This looks like maybe your email.
Try that again. Worst case, I can forward you the link if I can't seem to
Sure.
get that. Here it is. Let's try that. Okay, how about this?
Perfect.
Okay, there we go. So yeah, here's our coverage map, our service area for the Cleveland, Ohio market. Let's see if I can zoom out a little bit just to kind of give you an idea. I'm based out of Cincinnati, so Cleveland's not my market, but this is generally our service area. So hopefully that kind of matches up well with a lot of folks who are on here today.
Keith, we have a large population of membership in the Oberlin area. Do you know if there are any plans to expand a little west outside of Elyria, or if they actually do go into Oberlin at this point?
Yeah, you know what? That's a great question, Marla. I honestly don't know. I can certainly find out with the folks in that office to see.
Okay, that'd be great.
Yeah, I will get back with you on that.
Thank you.
Let me just click over. How about Central Ohio?
Yep, we have Columbus,
That work?
Cincinnati.
Hopefully you can see my map right now.
Yes.
Okay. And I'm on our website at dispatchhealth.com/locations, dispatchhealth.com/locations. And I can send a link as well Just trying to center this a little bit. Hopefully this service area matches up well. You know, if we're on the edge of a territory or a area that borders our service area and we're just on the outside of it, I mean, we can make exceptions. I mean, if our teams are close by and it can work. I mean, if it's within a few miles or, 10 miles, we've made exceptions to go out of the area to do that. So it's usually not a problem if it's not too far out of the area.
Okay, great. Thank you.
Mm-hmm. And I'll do Cincinnati. That's where I'm from. So here's Cincinnati. And I know we keep expanding east. We just expanded out to like Mount Orab and Hillsborough area. So I'm not sure if anyone is out that way. And we go by zip codes in all of our markets. It just kind of depends, I think, where the demand is. And we add per zip code or in groups of zip codes at a time. So, there might be gaps in like certain counties where we just cover part of a county. It may not mean the entire county would be covered, but yeah, if we can ever make an exception, if we're close by, we can definitely do it. So.
Wonderful. Thank you. And then you're also in Western Massachusetts, so we can get that information at another time for members out there as well.
Okay, sure.
How long has DispatchHealth been around, Keith, as an organization?
Yeah, we've been around since 2015, and it's based in Denver, Colorado, and it was founded by an ER physician and a physician assistant. And of course, they're in the ER, they're seeing patients every day, and they're seeing a lot of things that are what they felt truly are not necessary. They don't have to be in the emergency room for these cases that they're there for, and they're looking for a better way to treat them safely and more quickly, more efficiently, and to keep them out of the ER, keep them out of the waiting room. And they came up with this model where we teamed up with the South Metro Fire Department in Denver, Colorado. And anytime there was a 911 call that came in and we found out it was not life or limb threatening, well, we had a team of a physician assistant and a medical technician who actually would go out to the home. Once it was deemed not a true emergency, we would go out and treat them right there in the home. And that pilot program that started in Denver back in 2015, that is where DispatchHealth was really started right there. So.
Such a wonderful model. I wish I thought of it years ago. Right?
Yeah.
I'm sorry.
Oh, I was going to say we're in over 20 states and we're in over 45 markets across the country right now. So we're definitely growing.
Wonderful. We do have a few questions, and I think I know the answer to this, but I'm going to ask you if, while on the scene, if an issue should escalate, do you have the ability to transport an individual to the emergency room?
Yeah, in the event that we have to escalate on scene, DispatchHealth is not able to transport. We would have to call 911 to come out. We would have to wait to do the transfer. We would give the squad all of the information to them before they leave, but we would not be able to transport.
Okay. What if someone has occasional nosebleeds that require them to be cauterized? Is your staff able to do that?
Yeah, cauterized nosebleeds, we can certainly do that. It's probably one of our most common calls that we get. Yeah.
Are there any plans to expand the hours beyond 8 a.m. to 10 p.m.?
Not that I know of. I have not seen anything come across yet on that. And that's pretty standard across the board at Dispatch, 8 to 10 in every single market. But I have not heard anything yet going later than that or even earlier.
Sure. Okay. I think there's one more. Will you tell their care coordinator if they have to call you? So I do want to mention one thing that we had as a partner with between Kendal and DispatchHealth is that if you mention to them that you are a Kendal at Home member, they will be able to track information for utilization for us as well, but they won't necessarily contact your care coordinator. As of right now, we would still request that the member do that unless you provided the care coordinator name and number. Would they be able, possibly, Keith, somebody from, I don't know, while they're in the moment, let a care coordinator know that they're being treated?
Yeah, our medical team does follow up, so they should be reaching out to you or to your team to let you know what's happened.
Okay, great. How many teams cover the Columbus area?
It's a good question. I don't know if Laura is still on. I know Laura covers our Columbus market. I don't know the true answer.
Supervisor?
So, hi. So as
Hey,
far as
Laura.
the Columbus market, I did put my information in the chat, my phone number and my email address. So if anybody in the Columbus area or Newark area, please feel free to email me, reach out to me with any questions, or if I can be of any assistance in any way. As far as teams, I'm not sure if you're talking about staff or cars. I mean, we do have 3 of what we call our rover vehicles, and with the expansion of the 4th coming in the fall. Does that answer the question?
I think it does. Yep. People are asking about Oberlin, so we'll get a little more information. I can reach out to Brittany in the Cleveland area and see if we're able to tap into Oberlin. We have a good amount of members in that area that would likely make it worth, and a CCRC that belongs to Kendal and Oberlin out there. So it might be a great means of expansion if we're able to go a little more west. So yes, who is asking me this? Laura will let you know if we're able to do that. Very good. Oh, let me just check one more time. Any plans to expand into the greater Boston area? I know you're in Western Massachusetts, but any plans to move into Boston?
That I don't know. That I have not heard anything. Those decisions are above me a little bit, but I'll check. I will definitely check on that.
Okay. All right. And Carol, I see your message as well. So we'll let our members that are in Oberlin know about being able to utilize your services.
Yeah,
for sure.
Big demand for Oberlin.
Yes. Yep. Just checking one more time. I think we've gotten all of the questions. Oh, nope. Does the cost of a visit or procedure vary according to what supplemental plan I have, or are the costs fixed?
Yeah, so as far as the way we bill, we always bill like at the urgent care level for any insurance plan. It's just going to depend on your insurance plan, what that is, whether that's a copay or if it hits your deductible or if it's co-insurance. So it doesn't matter what we do in the home. We could come see you. We could, in one visit, we could cauterize a nosebleed. We could do an EKG. We could do lab work. We could set a minor bone break or a fracture. We could do all of those things in one visit. It's still one global charge, and it's still going to be that relatively affordable charge compared to the ER. But I don't know exactly what that charge would be. But we give a general range. You know, $0 to $50 is commonly what we see for Medicare. Hopefully that helps.
It does. And if you have a radiologist, let's say, read an x-ray, they're not getting a supplemental bill from that person as well, or would they expect to see a bill?
So good question, Marla. Yeah, so in that case, if we come out to do an x-ray, and we do have our own mobile imaging company now, it's called DMI, or Dynamic Mobile Imaging. It's part of DispatchHealth. And yeah, in that event, there would be a separate charge for the x-ray. There would be a radiologist charge as well for reading that. Offhand, I don't know what those are,
Okay.
but I'll check. I just talked to DMI today, so I will look into that.
Okay, great. Check our questions one more time. Oh, do I plan to get this information, Kendal? I think it would be a good idea to share the DispatchHealth information with our CCRC in the Oberlin area. So yes, we can definitely share that with them too. All right, Well, thank you so much, Keith and Laura, both for joining us today. It's great information. I think it's a great service. I know we have had one member that I can think of off the top of my head that has utilized your services and had great things to say. So
Good.
especially in the world of COVID, I think anytime we can prevent possible further exposure to other things and be able to stay at home is wonderful. So
Yeah. Great. Well, thank you. I appreciate that. I appreciate your time.
sure. I'm going to just take one moment though to share a screen and let everybody know what other events we have coming up in the next couple of weeks. Hopefully you can see this. On May 13th, we have our brain health series with our cognitive consultant, Jennifer Brush. She will be discussing the stages of dementia. On Tuesday, May 17th, we have Meet the Team, and we're excited to introduce Natalie Lopera, our newest care coordinator. She is in the Boston region, and she will be joined by Danielle Dennis, who is one of our regional sales managers in the Columbus area. And on Friday, May 20th, we are hosting one of our partners, Benefit Personal Training, who provides personal training in the home of our Massachusetts members. They will be discussing Healthy Aging Matters, the facts about age-related height loss. So if you haven't already, take a look at the calendar and feel free to join us for any of those upcoming events. And again, thank you all for joining us today.